Severe acute respiratory syndrome is the disease caused by SARS coronavirus. It causes an often severe illness marked initially by systemic symptoms of muscle pain, headache, and fever, followed in 2 to 14 days by the onset of respiratory symptoms, mainly cough, dyspnea, and pneumonia. How do you get SARS virus? The primary way that SARS appears to spread is by close person-to-person contact. SARS-CoV is thought to be transmitted most readily by respiratory droplets, droplet spread produced when an infected person coughs or sneezes. SARS symptoms are similar to those of the flu, including fever over 100.4 degrees Fahrenheit, dry cough, sore throat, problems breathing, including shortness of breath, headache, body aches, loss of appetite, malaise. How long does SARS virus last? What are SARS symptoms and signs? Symptoms begin 2 to 7 days after acquiring the virus. Initially, the illness resembles influenza and lasts for up to 1 week. Symptoms include fever, chills, headache, aches or pain in the muscles, general feeling of weakness, malaise, and poor appetite. Can SARS virus be cured? There's currently no cure for SARS, but research to find a vaccine is ongoing. A person suspected of having SARS should be admitted to hospital immediately and kept in isolation under close observation. Treatment is mainly supportive, and may include assisting with breathing using a ventilator to deliver oxygen. What does SARS look like? Symptoms of SARS in general. SARS begins with a high fever, temperature greater than 100.4 degrees Fahrenheit, greater than 38.0 degrees Celsius. Other symptoms may include headache, an overall feeling of discomfort, and body aches. Some people also have mild respiratory symptoms at the outset. About 10% to 20% of patients have diarrhea. How did SARS spread so quickly? The primary way that SARS appears to spread is by close person-to-person contact. The virus that causes SARS is thought to be transmitted most readily by respiratory droplets, droplet spread produced when an infected person coughs or sneezes. Can SARS kill you? Even then, many of these people die. Worldwide, the death rate from SARS seems to be about 10%. Although it is now well established that the SARS virus can kill on its own, 8 other viruses that have been isolated from patients with SARS-9 could exacerbate the illness. Is there a SARS vaccine? Developing effective and safe vaccines is urgently needed to prevent infection by severe acute respiratory syndrome (SARS) associated coronavirus (SARS-CoV). The inactivated SARS-CoV vaccine may be the first one available for clinical use because it is easy to generate. However, safety is the main concern. How does SARS affect the lungs? Infection with the SARS virus can lead to severe inflammation in the lungs, which can lead to respiratory distress, fibrosis, and eventually lung failure. So, in a trade-off, the SARS virus increases its short-term gain at the expense of long-term damage to its host. Is SARS a chronic disease? Severe acute respiratory syndrome (SARS) is caused by a virus called SARS-associated coronavirus. The disease first appeared in southern China in late 2002, then spread to 28 other countries, with 774 deaths from more than 8,000 cases. Older people and those with chronic disease are at higher risk. Is SARS a chronic disease? Severe acute respiratory syndrome (SARS) is caused by a virus called SARS-associated coronavirus. The disease first appeared in southern China in late 2002, then spread to 28 other countries, with 774 deaths from more than 8,000 cases. Older people and those with chronic disease are at higher risk.